ever had your kid overhear you grumbling about bills and suddenly they're asking if you're moving into grandma's basement? Kids have a wild imagination, and when it comes to money, they often fill in the blanks with the worst case scenario. But for millions of kids, financial instability isn't just imagined, it's real. Right now in the US, more than 1 in 6 children live in poverty, and nearly 4 in 10 are in low-income households struggling to meet basic needs. That means tens of millions of kids are growing up with rising rent, groceries that don't stretch far enough, and parents having to choose which bills to pay each month. Even when we try to shield them, kids pick up on the stress. And sometimes imagine the situation is even worse. That anxiety can shape their mental health, their sense of safety, and even their choices around substances. Hi, I'm Jodie Sweetin, and this is Awkward Conversations, where each week we help parents raise confident, substance-free kids who are ready to make smart choices. Today, we're talking about economic instability, how financial stress, whether real or misinterpreted by a child, can influence their mental health and decision-making. And spoiler alert, the most powerful tools to protect your kids don't cost a thing. It's about love, time, and connection. And we'll show you how to make the most of all three. From tough topics to real solutions, this is Awkward Conversations. And I am so excited to introduce my lovely co-host, Amy McCarthy, who is a senior clinical social worker at Boston Children's Hospital in the Division of Addiction Medicine. Welcome, Amy. Thank you for being here.
Thank you so much. Happy to be back. I'm really excited about today's conversation because financial instability is something so many families face, and it can impact kids in ways parents don't always realize. To help unpack this, we're joined by someone who's been on the front lines of prevention work for years. Beverly Johnson is the Director of Prevention Services at the Alabama Department of Mental Health, where she leads statewide efforts to keep kids safe and healthy. She's helped shape everything from opioid prevention campaigns to community mentoring programs, and her leadership was recognized nationally with the 2023 Keddy Award. Hi, Beverly. Thanks for joining us.
Thank you.
Also joining us, returning for the third time to Awkward Conversations, is Dr. Gary Kirkus. He's a board-certified pediatrician who doesn't practice out of a typical office. Instead, he drives a 40-foot mobile medical clinic to reach children living in shelters or on the streets throughout Phoenix, providing free medical care and behavioral health support. He's also a national spokesperson for the American Academy of Pediatrics. Dr. Gary, welcome back.
Thank you for having me again.
Absolutely. You know, I know that one of the things that we want to talk about is what exactly economic instability means for families and for kids.
Sure. Economic instability can be referred to in terms of the uncertainty of resources or the amount of resources that are needed for the essentials of daily living.
Yeah, this is something that so many families, again, struggle with, and includes things like housing stability, food access, transportation, childcare, healthcare, and education. Dr. Gary, from your perspective as a pediatrician, what does economic instability look like for the families that you serve and work with?
Yeah, I could take on a variety of flavors. I mean, we have families who mom or dad has lost their job and they can't be in ballet classes anymore. They can't be on the soccer team anymore. And that's a big impact to that child. Or it could be anywhere from where both parents can't find work and they have to decide, are they going to pay rent, or are they going to pay their car bill? Or are they going to pay groceries? And there's a lot of turmoil there. And it could also include, having to move into a family member's house, or even homelessness. So it takes a lot of different flavors, a lot of variety with that economic instability.
We know that now 16% of U.S. children, which is 11.4 million children, a staggering number, are living in poverty. And so, we're talking about a large number of, young people in the country.
And I know a lot of those numbers are set to rise, and we're still trying to figure out how we can best serve communities. How do children typically perceive financial stress? It's not like you're talking to your kids about how you're going to pay rent, but oftentimes they kind of absorb the information that's going around. They overhear conversations. How does this affect children, even when parents are trying to protect them from it?
As we're talking about the topic of financial stress, and we use an operative word there, stress. And so, in those moments, children, pick up certain aspects, right? different factors that are occurring, within the household or within the family. And so within that, there is, or the potential for certain levels of stress to be incurred as a result. The uncertainty, the unknown as it relates to what does this all mean. And as Dr. Gary mentioned, like some of the different variables that perhaps are associated with the result of that. And so all of those things, when you take those in consideration, can be stressors upon a child.
I feel like oftentimes parents and caregivers do try to shield their children from the realities of these situations. And it's not until maybe, they're asking can't they get the newest, PlayStation, 700 or whatever, it may be, or Jordans or something like that, or, and sometimes smaller things that they might realize, well, I can't have those things because we're not able to kind of afford those items. And I think it's important for parents and caregivers to reassure their children, of the reality of some of these situations too, because like we talked about already, sometimes kids can kind of, extrapolate a little bit further and kind of think, oh my gosh, we're not going to, be able to, have security in our lives without, these things. So being able to provide that reassurance being really important that they're safe.
Absolutely. And I know probably during the pandemic, financial disruption was even more immense, and it led to a 205% increase in youth perceived stress, which is huge. And I know, we've come out of the pandemic, but I know a lot of those issues and those things for families are still there. What is the connection between, a family's financial stress and a child's risk of using substances? Those things might not seem connected.
I think one of the important things is to take in consideration is the complexity of it. And, what are some of the correlating factors that are associated as a result of economic instability that may contribute? Is it relative to stress? Does it lead to, attempting to self-medicate? Does it lead to, those particular stressors that lead to utilizing substances? So, it's just important, to understand the complexity of it as it relates to economic instability and the utilization of substance use, because there may be, varying underlying factors that are associated with usage.
It sounds like what you're saying in some ways is that young people living in poverty or in low income, homes or families itself isn't, the cause of substance use, but some of the, again, like you said, underlying factors, like such as parents, not being able to be home with their children as much because they're working long hours, or lack of access to, extracurricular activities,
communities
with strong
sports,
peer supports. Those types of things may ultimately kind of contribute in some ways. Is that fair to say?
That is fair. Yes. Yes.
Dr. Gary, do you see, kind of a difference in families that you work with and how young people are using substances, whether, it's more affluent youth or, kids that are more financially strained or stressed?
Yeah, I mean, certainly, I take the typical patient who comes from a affluent family. More often than not, their substance use is more of a social lubricant. It's a Friday, Saturday night. They're with their friends. They're going to drink alcohol. They might smoke marijuana, or it's just recreational. They're just trying to explore. Not always, but typically. In families that are experiencing economic hardship, a lot of times I see it more as numbing the stressors of life. Certainly someone who's experiencing economic hardship, there's going to be a lot more stressors, right? They don't know where they're going to live. They might lose their car. They have to downgrade their house. Parents are worried about paying rent. So there's a lot of stress in that whole experience. And so more often than not, they're self-medicating. They're trying to numb those experiences. That's not to say that it's always the case. And as it was alluded to before, I have families who are well under the poverty line, but their family is intact. They have a good community. Those kids feel really loved, and they don't succumb to substance use. On the other hand, I have families who are also equally experiencing hardships, and their family unit isn't intact, either because parents have substance use issues or behavioral health issues, and then they do succumb to that. And that's one of the many variables. But that also could be said to families who are affluent. There are families who are quite affluent, and parents are away, really tied to a job, or the family's disrupted, and they also turn to substance use. So a lot of variables when it comes to that.
Yeah, trauma and stress are huge indicators for, self-medicating and young people learning how to deal with stress in really unhealthy ways and unhealthy coping mechanisms.
And in either circumstance, the introduction of substance use at a younger age puts those youth at equal risk of long-term substance use, I would say.
Exactly. Delaying that age of first use, of first experimentation. We always try and talk about, we know on this show, you're not going to, the just say no messaging and scaring your kids, that doesn't work anymore. It never worked.
Right,
We've learned that having real conversations and being open and listening is really key and vital. And what other protective factors can help kind of buffer kids from the negative effects of economic instability? You were talking, Dr. Gary, about families that might not have a lot of economic resources, but their community resources and their family bonding and togetherness are really there.
Yeah, I would say having a really, that intact family unit is very protective. I'd also, when counseling my parents, I also encourage them to help their children find a tribe, whether it's they're in an art class or their soccer team, or if it's a skate park or some sort of tribe where kids can have a unit outside their family that's supportive, where they feel like they belong. And importantly, that unit should be something that's strong, right? You don't want them to be around peer influences that are going to lead them to making bad, risky decisions. The other thing I would add is taking a look at children that you might feel are very sensitive. When we have a family, they might be like 3 or 4 kids and they're all experiencing the same trauma, but one in particular seems to have an issue with substance use. And that child is often described as very sensitive. They cry the hardest, they love the hardest. They may not have that resilience to traumas and stressors. And so really focusing on that child that seems very sensitive, to really build on resilience and having extra conversations with them about, these are stressors in our lives, these are hard moments through our lives, but we need to be resilient, know that I'm a person you can lead to. That's also protective against substance use.
I know we've been talking about financial stress, but there is a large portion of the American population and of our audience that is probably dealing with acute economic stress and instability. What are some of the free or low-cost resources that they can turn to?
Sure. I think that what would be beneficial for individuals and families is to become connected with their local community resources, those assistance programs that are available within their respective communities, to be able to also tap into perhaps some of the faith-based resources that are available, whether those be for, assisting, with food, whether those be, like food banks, whether those be, assisting, with clothing, or there may be utility assistance and things of that nature, but really tapping into some of those local resources to be able to provide the necessary supports and assistance.
There's a national toll-free number that connects you to a lot of local assistance for rent, food, healthcare, mental health, and I believe it's 211. If you dial that wherever you are in the United States, it will connect you to resources in your area for all of those things that you might need help with.
I would also add 211 is a wonderful resource. I've used it lots of times in my work as a social worker. And also, I think leveraging schools in your child's school. So if you're not sure where to turn, often, there are staff in the school that kind of have ideas in the community. Facebook and social media and like community groups and like, buy, sell, nothing kind of groups.
Oh, yeah.
Like,
I love buy nothing.
Like parent resource kind of groups. Like parents are the people who have been through this often before. And so they are often the best people to give you information about where to go in your community for help, in my experience. And I used to run a family resource center. So this is what we did a lot of. And so being able to even just Google resource center in your community, many states have like a statewide network now, but regardless, that's a place where often there's a one-stop shop to get access to, any type of support that you may need.
Right. It can feel really daunting. And I know libraries are also a great resources.
My gosh, so great.
Libraries are great resources for so many things, but your local library is also a place where you can go and say, hey, I need help with this. And, they're trained to point you in the right direction. So don't let it be overwhelming or scary. There are resources out there that really can help.
You reminded me too, like constituent services through like our elected officials often are another place where again, you can get help. And I would never think to call my elected officials, but I've seen them be able to do a lot in terms of helping connect people to what's out there.
Absolutely. Dr. Gary, what are some of the resources that you use or that you recommend to some of your families and patients?
Yeah, so I think one of the best things to do is getting in touch with social work. And that's really what I do as a pediatrician. They have an array of resources they can get people in touch with. Usually they are more in tune of what things are available, what things that can be covered. So if a person finds them at or below the poverty line and they qualify for Medicaid, there's a whole world of things that they can get through that insurance, because a lot of these things are cost-based. So if you need counseling services, doing it through Medicaid, school lunch programs, daycare reimbursement offerings, a lot of social workers are able to get into that. So that's what I point to in my patients.
And Dr. Gary, of course, you're reminding me that pediatricians are such a wonder. Like pediatricians often have social workers connected to their clinics or wherever they may be. So like, of course, medical providers too.
What do you tell parents who feel that maybe they can't give their kids enough because, of money struggles, or that it's not the right kind of support? How do you deal with families and the stress on parents and kids of dealing with, how that perception of being economically insecure affects them?
It comes up quite a bit, like in our parents, they'll say some things like where, my child is one of the only ones that depends on the school lunch program, or my child is the only one that's not playing sports. It's really, the tendency I have found is that parents kind of just brush that under the rug, and they don't really want to discuss it because they don't really have a good answer for it. But I always tell them, you have to have that conversation and say, look, this is what we're dealing with. It's nice to be able to have our own lunch and not depend on a school lunch, or not depend on food stamps, or to play those extracurricular activities that cost money. But this is what our reality is now, and we're going to get through this. And the most important thing is that we have each other. Sort of centering back to the most important things, because those are the most important things. Yes, it's nice to be able to go on family vacations. It's nice to have those other things, but to really center that, look, we have a house, we have each other. This is what's most important. Sometimes kids can get a hold of that message, especially if they're young. But yeah, that's what I point to.
Welcome back to Awkward Conversations, and welcome to Season 5. I'm Jodie Sweetin, and this is Awkward Conversations, where each week we work to give parents the tools they need to raise happy, healthy, substance-free kids. It's Season 5 of Awkward Conversations. Let's get into it.
I think maybe we try to scare kids into not using illegal substances. But today, we equip them with the tools to make really good choices. We've gone from just say no to just say no, KNOW.
Now you can download a short animated explainer for kids 6 to 9, so you can watch it together and start the conversation.
And now each episode comes with a parent guide with simple tips to use before, during, and after viewing, plus ways to adapt the same lessons for older kids and teens.
And this is just one topic. Each week, you'll also find new explainers and guides on sleep, nutrition, tech safety, peer pressure, mindfulness, and more. Visit GetSmartAboutDrugs.com to access the full library of explainers and guides and every episode of Awkward Conversations.
You're listening to Awkward Conversations. Thanks for being here.
I think it's so important for everyone listening to recognize that we're not looking to villainize families who are living with, financial instability. It's already so hard, right?
It is so hard.
Yeah.
And, we're seeing so many programs being cut or defunded that we know that this is going to be a problem that so many more families are having to deal with. And the support that we can offer and help them find, life is a struggle, and economic insecurity affects so many people. And, I've been at times in my life when we've gone to Target and the car doesn't go through and we have to leave everything there, and it's awful. And your kids look at you like, what's happening? And, it can be really stressful for parents and for kids.
Yeah. I also, grew up in a home where, I did have free lunch. Like, there's not enough money to pay the bills often. And I think back to how stressed I recognize my mom was sometimes if she couldn't give us like the birthday present that we always wanted, or, I wanted a 1998 navy blue Jetta, never got it. But like, she was so sad that she couldn't give that to me. But now as a parent and as an adult, I don't think about the birthday presents I got, or that
Right.
like I think about the times that we had together as a family, creating memories. And when I've worked with families who are struggling with financial instability, that's the thing that we try to focus on is, like your child needs those good times together to get them through the harder times. And so where can we create space for you to create positive, meaningful opportunities to connect? And that being the thing that is going to be the biggest predictor of their, lack of their prevention of using substances, and also the prevention of so many other things around mental health and other,
Right.
not so positive outcomes.
Now, I do want to ask, one thing I know that can make that really difficult is oftentimes in, families that are struggling to make ends meet, parents have 2, 3 jobs. And even in families that aren't economically insecure, the rat race of life can really get in the way of those deep connections. But how do parents maybe who say, I don't have the time. I can't drive my kid to school. My kid takes the bus to school and I'm just trying to make ends meet. What are some suggestions that we can offer those families to say, you're not alone, you're not doomed. There are other ways to connect, and finding them is really important.
Yeah, that's an interesting question, because I get that question both from families who are experiencing economic hardship and they're not always there, as well as from affluent families who, they're tied to a crazy work schedule where they're constantly flying away, or they're children of, surgeons and their mom or dad's never home. My advice to them is that, life is difficult and sometimes our work lives are going to take us away, but to be really intentional about having a moment with your kids, even if it's like 5 or 6 minutes, really make that a priority, to where you just connect with them and ask them, how are they doing? What's been great in your life? What's your challenges? Just those little connections. If that's the best you can do, that's great, because that's what is really important too for kids to know and to understand that their parent, even though that they're gone a lot, that they still have them in mind. And then when they do get a chance, they connect with them, even though it might not be as much as they'd like. Children need to know that their parents are thinking about them.
Or in my case, I was an actor, so I sometimes have to go out of town for 3 or 4 weeks at a time. And it can be really difficult and really stressful on the parents, feeling like they're not doing enough or the right way. But I think that really what we're trying to focus on here is that, again, this isn't the financial stuff. It's the connection. It's the conversation. It's the intentional time spent together and really maximizing that, even if it's 5 minutes. Life does get busy. And I think letting parents know that the expectation is not that you're going to have hours of free time with your children when they come home and you're baking cookies and it's all, that would be nice, but oftentimes that's not the way the world works. And that connection is really the one thing that will help make a difference.
And in so many ways, of course, nobody can replace your parents and your caregivers. But we've talked about in some other episodes too, that other caring adults in your children's lives can also make a huge difference. And so if you aren't able to be there, then are there ways to have other caring adults be a part of their life in some way, shape, or form, whether that's a coach or a teacher who really takes interest in a neighbor, grandparents, aunts, uncles, whoever it may be? Are there ways to bolster that community for your child so that they have the support, that you, of course, want for them?
Yeah. One thing I will say that I was always really proud of with Full House, and that we got mentioned a lot, was that the example of that family that wasn't your typical family,
Right.
that was a little bit different, that was maybe parents not necessarily, or parent figures not necessarily knowing what they're doing, but trying their best. I was always really proud that the show talked about that, because I do think it was something that both parents and kids needed to hear, that there is no right family.
Right.
There is no right way to do this. There's just love and communication, right? And that's kind of all we've got.
Finding the tribe, like Dr. Gary said.
Yes, finding your tribe, absolutely important.
Yeah, it's a great life lesson, and I think parents might approach this as, how do I get my child to feel that they're whole and their self-esteem is intact, even though they might be the only ones that are on the school lunch, or how do I get my child to feel that I still love them even though I have to work a lot? And it's really hard, and I don't think there's no one right answer. Again, I sort of harken back to really having those connections with kids, to have those really frank conversations and say, look, you know what? I know it kind of sucks that you're the ones that have to depend on the food lunch program, but that doesn't mean you're any different. That just means that this is a struggle that we're going to overcome together, and sort of revisiting that with them, to make them know that they are not different or not as worthy as other kids, because they need to hear that from their parent. Likewise, if you're a parent who's always away and their children are comparing themselves to the maybe the mom that's a stay-at-home mom and their mom is always home, but your mom has to spend longer at work. Again, connecting with them and letting them know that they still are loved, and this is how our life is set up, and this is my work responsibilities. That doesn't mean I don't love you any less. In both scenarios, you're basically addressing the child's needs, because all kids, they want to know who's going to take care of them. They seek that security and that stability, because they don't want the idea of abandonment. They're always very keyed into who's going to take care of me. So in both of those scenarios, having that time to connect with them is super important.
I love what Dr. Gary mentioned there, because minutes matter, right? Even if you're in the hustle and bustle of things. Some of the things that, that you can employ as an example, if you're on your way home and of course, you're thinking, in the midst of the day, now it's time to get home. There's, the homework, preparing dinner and things of that nature. Perhaps on the way home, take 15 minutes and go to the park, sit in the park, have a conversation, how was your day, having that level of connection, and so whereas, you're not seeing it as, like this, lengthy amount of time, right? But these are minutes that you can give, that you're in an environment, in a serene, calm environment, that's kind of away, from, all, the hectic day-to-day routines, and just providing that space, to have those conversations. So even employing those minutes, those will be helpful as well.
Great. And one of the things that we've talked about before, and that, we mention a lot on this show, is that oftentimes you can find mental health care for parents or for kids on sliding scales. Mm-hmm. You can find, students who are in their master's programs, and they're incredible. My kids have used, services like that. I've used services like that. It's really important to know that the mental health support, even if you don't have the financial ability, can be met. It might be a little more difficult, but it is there and it is available. And it doesn't mean that you are shut out of receiving the kind of mental health care that your family might need.
Right. And I mean, again, none of this, like you just said, Jodie, is easy. There is an added additional strain on families in these circumstances. And also, I think, we know that living in poverty or with a financial, instability is a risk factor for substance use. But families can also go and look at, like, what are the protective factors and how can I maybe build those things into my child's developmental, kind of experience. And so, again, these are the things that we've already talked about: having a mentor, having, a hobby or an interest, having access to green space, different things like that. And so that may arm parents with ways to think about how to also combat some of those risk factors. And just because you live with a risk factor does not also mean that you're automatically going to have difficulty in life either. And so I think,
right.
Just reminding people of that this isn't a life sentence, or this isn't a guarantee by any means either.
Another thing that can really come from, either economic instability or a lot of work for parents is bringing some of those stressors home. Bringing some of those bad days at work, those intense moments, bringing it home and inadvertently kind of taking it out on your kids. Do you have any suggestions for parents on ways that they can help to emotionally regulate themselves a little bit when it comes to some of these things, these stressors? Maybe take a few minutes sort of in that transition period of coming home before they interact.
Giving yourself permission to pause and reset. Of course, with all of, the daily task, or whatnot, and the stressors that are associated with that, just giving yourself that permission to pause and reset, letting your children know that you need that time, and it's okay, for you to be able to take that time, and so that they will have an understanding, so that they don't feel like that there's a level of, disconnect or it is, something that perhaps they did or anything like that.
I love what Beverly just said. I mean, that's honesty and giving yourself a break. I myself, if I'm having a bad day at work, I sort of announce it so that people know, so it doesn't come as a surprise. And I think people don't do that enough. As parents, our job is to take care of our kids. So it's like when we come home, we got, put dinner on the table, do homework, get everyone ready. And so you kind of take that on, but, maybe just kind of announcing it and say, you know what, I had a rough day. Can I just have 5 minutes? And everyone just kind of knows that, not to necessarily be afraid of you or just to know that, hey, I had a bad day. And that can then be modeled to your children, so that when they're having a bad day, especially if you have a teenager that had through a stressful event at school and they're carrying with that, if they can model your behavior, announcing that and say, hey, I had a really bad day at school, then the parent doesn't mistake their child as being, angry or
Right.
upset about something, or just, giving attitude back. So it's nice to sort of just kind of be having open lines of communication about how they're doing, because you're right. If you kind of hold that in and someone says something, you're gonna tip the scale and kind of have an outburst that you
Right.
would later regret.
And kids push buttons. Kids and parents, we install each other's buttons and then we just push them. But yeah, I have always tried to make it a point to do that with my kids and tell them, I'm really stressed right now. Can you give me a minute? Or if I snap at them and I have them and I just will turn around and go, I'm sorry. That wasn't you. This is stressing me out right now. And I snapped at you. Give me a minute and let's come back to this conversation. I think that's something that parents, the idea that we don't have to be this facade of perfection, that really the best modeling we can do for our kids is show them when we have a hard day, show them when we're going through emotions or upset, and how we help to regulate ourselves and what skills we can teach them. And that, having stress and human emotions it's just part of it. And it's really not about trying to prevent those things, but how do we deal with those things?
And I also think this can be such a tall order and for caregivers, but thinking about accessing those mental health resources for your children, but also potentially for yours. But like you said, Beverly, it's important to give yourself permission to take care of yourself first, like kind of the oxygen mask on the airplane, right? You have to take care of you before you can kind of take care of your children. And so I'm a new parent. I have a baby at home now, and I have quickly learned that I'm like, oh my gosh, I'm not with her. So I'm not doing the right thing. But being able to sit in the driveway for 10 seconds, maybe even, or maybe a minute if there's, and be able just to reset myself. It is what will make me and does make me a better parent to her when I'm able to walk through the front door, I think. Right. And going to therapy and taking that time, gets me to a place that I hopefully can be more present and intentional with her.
Right. I also try and reframe, with my kids when I'm busy or working a lot, I try and reframe the idea that I'm not away from you, but I'm hopefully modeling for you what it means to show up.
Right.
I'm showing them what it means to have struggle and succeed. I think that sometimes those are really important lessons that we overlook in the desire to be the quote unquote perfect parent. And really the perfect parent is just the honest human. So,
yeah.
How do we help reinforce to parents and caregivers that it's really about how you act and not about your financial situation that is the determining factor with, kids and risk of substance use and stress and things like that. Some of the wealthiest people that I've known have had incredibly traumatic, broken home lives. And some of the people that I know who came up with nothing are the most loving, wonderful, happy, well-adjusted humans. It was all based on what was modeled for them.
As I shared early in the episode, I grew up in a home where we didn't always have, financial stability. And I think about the way that my parents, treated us and how they reinforced our worth beyond the financial situation of our family. I think a lot about how I had an opportunity to see them in action at work sometimes and know that they were working hard on behalf of us as kids and doing their best. And I had the privilege of having a mom who went back to school when I was younger and being, she was so conflicted about being away from us, but how proud we were when she walked across that stage after 5 years with her associate's degree, and then at almost 60 got her bachelor's degree. And so again, did we always have enough money to go around? No. But did we feel loved even when our parents weren't able to be there with us all the time? Yes.
Some of the resiliency factors that you mentioned, I think that those, are really important. And then also just establishing, spaces where there's a level, of safety and security.
And a lot of these things are going to be life lessons. And so we're not going to create a perfect reality for our children, nor should we. Because even if you had the perfect job and you had the perfect amount of time that you could spend with your kids, when they get out in the real world, that's not going to be the reality for them. And so they need to have these challenges. They need to see, mom and dad working. They need to see how that you overcome and how you model behaviors with those challenges, because that's all life lessons for them.
Resiliency is really like the number one factor in determining how well you will cope with stress, right? Is learning to bounce back from things.
Absolutely. So not, again, the parents shouldn't beat themselves over not having creating the perfect either family unit or anything like that. But this is all life lessons for kids.
Yeah, Absolutely. This is such a wonderful and important episode, as so many families are struggling financially right now and looking for services and benefits to help their kids live the most successful, substance-free, happy, well-adjusted lives. And, Dr. Gary and Beverly, you are doing some incredible work, and we just really, really appreciate you coming on the show today. Are there any final thoughts that you would like to leave parents with or families with, about what they're facing with helping their kids become well-adjusted, substance-free adults?
Just being connected, establishing those bonds, being intentional with utilizing the time that you have to have that necessary connection within the family unit, being connected to those particular supports, whether those are, within the family itself or whether those, or, additional peer influences that are within the community, those positive peer influences. And then also, where the children spend quite a bit of their time, like within the school systems, right? Tapping in, to those resources and those supports that are within the school systems.
Absolutely. One of the things I used to do when I was really busy and working, I would leave a little Post-it note on my kid's mirror or on their door and just say, hey, I love you. Have a good day. My mom wrote notes in my lunch, and it made me feel loved and connected. So Dr. Gary, do you have any last thoughts that you'd like to leave parents with?
Yeah, just simply that, our role as parents are to provide for our children, housing, food, but most importantly, love. And if a child feels love, that's mission accomplished. And so, yes, there's a whole lot of hurdles in life. Life is terribly complicated, but if you can do the little things like Post-it notes or 5-minute conversations that your child knows that you love them, well, then congratulations, you're a parent, you did a great job.
Great. Thank you so much for having this really important and not terribly awkward conversation with us today. Dr. Gary, thank you for joining us a third time. You are a champion here at Awkward Conversations. And Beverly, thank you so much for coming today.
Thanks for having me again.
Absolutely.
Thank you for having me. I appreciate it.
It's been a pleasure.
Great. Thank you so much for joining us for such an important conversation. And I just want to say to all the parents out there, regardless of where you are financially, just know that as long as you are giving your kids love, attention, and connection, that you're doing the right thing. So I hope you'll join us for another episode of Awkward Conversations next week. And in the meantime, keep those conversations happening. That's it for today's episode of Awkward Conversations. I'm Jodie Sweetin. I'll see you next time. In 2023, the DEA seized more than 381 million lethal doses of fentanyl, enough to kill every American. But as a parent, what keeps me awake is that despite these significant seizures, a substantial amount of fentanyl still reaches these streets. And more the deaths that we're seeing are not just habitual drug users, but rather accidental poisoning in young adults, teenagers, and even small children.
The one thing we can count on consistently that we see great evidence for is the amount of pills we're seeing in the labs and the concentration of fentanyl that is loaded into those tablets or that is mixed in with those powders. If it's one thing we see, it's just a constant increase in the amount, not only in volume, but in the concentration.
What we know in prevention, one of the best first steps is education and raise awareness. So we launched One Pill Can Kill, the awareness campaign, almost now 3 years ago, September of 2021. And really the whole purpose behind that awareness campaign was to raise awareness along a whole number of different demographics.
Stay informed, stay vigilant, and let's work together to protect our children.
Make sure to check out GetSmartAboutDrugs.com. Parents, caregivers, you can find so many resources of great information there about how to talk to your kids and make these conversations a little less awkward. A huge thank you to the Elks DAP, which is the largest all-volunteer nationwide drug awareness program, and also a huge thanks to the DEA for their outreach program and for making this possible.
The views, information, or opinions expressed during the Awkward Conversation series are solely those of the individuals, speakers, commentators, experts, and/or hosts involved, and do not necessarily reflect nor represent those of the production, associates, or broadcaster, or any of its employees. Production is not responsible and does not verify for accuracy any of the information contained in the series available for viewing. The primary purpose of this series is to educate and inform. This series does not constitute medical or other professional advice or services. This series is available for private, non-commercial use only. The production, broadcaster, or its channel cannot be held accountable for all or any views expressed during this program.